So when I started graduate school at UCLA in the early 1990s, the evidence-based treatment movement was just taking off, but it was called something else at the time. I think it was empirically validated treatments. That's what we were calling it at the time. And there was a task force that had been developed by Division 12 of the American Psychological Association, and they'd sort of taken their lead from things that were going on in medicine at the time, this movement towards these empirically validated approaches to medicine. So when we talk about evidence-based treatment, we're usually talking about a particular intervention that's been tested in a certain type of trial, usually a randomized clinical trial, and has been shown to be effective or efficacious relative to some sort of control or comparison condition, preferably a placebo condition.
Community-defined evidence is relatively new thinking on the one hand, and yet very ancient thinking and practice on the other hand. Community-defined evidence is sort of just a new term that we coined in 2008 when the National Network to Eliminate Disparities in Behavioral Health, a network that was developed within SAMHSA, the Substance Abuse and Mental Health Services Administration, in partnership with a National Latino Behavioral Health Association, when we began a research study in 2008 to look at practices that may not meet the standard of the gold standard of evidence-based practice through randomized controlled trials. But yet we know, all of us practitioners out coming from communities know that there are lots of practices that are being done out there. Some of them are quacky and don't work, and maybe are being done just because they've always been done, and we keep perpetuating those that don't work. But then there's another set of practices that have worked, and they may be recent practices, they may be practices that have been around for decades, and in some cases, some practices that have been around for centuries and millennia.
Okay, let's look at the history of community-defined evidence. Meditation. Meditation in a recent research is identified as the best way to reduce blood pressure. When I left DMH, my blood pressure was soaring. I have been meditating since I left. And what is the best evidence-based practice for reducing blood pressure? It's meditation. How long, I ask you, by what communities has meditation been around in the world? Thousands of years, Buddhist monks, whole other approaches. And it wasn't until it was research, validated, brain research that really shows meditation really changes actually the way your brain functions. So acupuncture, forget acupuncture. So these are healing practices that have been practices for thousands of years. And it's only when that cloud of legitimacy, of money to really research this, they say, oh yes, then those practices work. Well, where are we in the field of community-defined evidence? Those communities who have been working, doing this work from my perspective, I've been in the field for 30 years. They've been doing this for 40 years. And where has been the research money to really fund those practices that they know work in those communities? And that's why we, I think, in California have the biggest investment in community-defined evidence, putting $60 million, which is nothing, to try and grow the evidence. What are we trying to do? Legitimize something that we know that works so that it fits the paradigm of research and science? Do we have to really do that to say these practices work? I mean, there certainly is a push to do that. And where's the money to really support that? That's what we really need. And how do we replicate those once we study them? So community-defined evidence, from my perspective, is a response to evidence-based practice and its lack of inclusion and historical discrimination in terms of not funding ethics-specific research.
Absolutely.
Well, I think that the biggest shame is the disparity between what we have happening in the ivory tower, which is where I live for the most part. I'll be quite straightforward and honest about that. Where we got a lot of research monies coming to people like me who then go out and create interventions to work with people in the real world sometimes, and other times undergrads and people with very limited, mild forms of psychopathology. And we're able to establish these efficacious interventions and then make arguments about how we should be disseminating these things now into the real world, and then kind of wonder why practitioners don't really adopt them. But then in the real world, we have people doing lots of things. I would argue that span the spectrum from just highly efficacious to probably harmful. But what we're not doing is evaluating those things. So that because we're humans and we have our own intrinsic biases, and because systems are conservative, and if there's a practice in place, there is a tendency for the practice to remain regardless of, what other kind of info kind of comes along. You've got just a range of things that we probably that sometimes are inert. They're not things that you're doing that aren't helping and they're not hurting. Other times you're doing things that are pretty bad and you should be getting rid of. And other times you're doing things that are really efficacious, and other people should know about this and learn from it and adopt these things. But because there's not good evaluation or not persuasive evaluation, people aren't sort of honing in on those things that work, that are intrinsic to communities, and they're not getting rid of things that are bad or neutral or inert. So I'm a big advocate of taking more money from, I hate to say this, I should be careful about this, from people like me, in the ivory tower, and distributing more of that to helping folks in the real world evaluate what they're doing. Because, I think we have skills that we can use to help people who are doing this stuff on the ground level better evaluate what they're doing and offer honest feedback about good practices, neutral practices, and horrible practices.